I'm Michael Swank. I'm a fellowship-trained joint replacement surgeon in Cincinnati, Ohio. I've been in practice 29 years now and limit my practice exclusively to outpatient hip and knee replacement surgery. Over the last 3 to 5 years, moved pretty much exclusively to the TruMatch custom cutting guide type of product for a variety of reasons. One is the accuracy, 2 is the ease of use, and 3, particularly in an outpatient setting, which is where I operate exclusively, there's some massive advantages to the custom cutting guides. So the custom cutting guides do a lot of things. First of all, they come up sterile, which is important. Second thing is everyone knows what we're going to do before we walk in, not just me and not just my assistants, but everyone in the room. And that cuts down on inventory dramatically. We're in a 6-room ASC, and last year we did 2,400 joints. And so with that kind of inventory, that kind of throughput, the opportunity for our sterile processing, the opportunity for the nurses to use less stuff, which is really what it boils down to, and stuff that's accurate so people know what to do, is really enhanced with a system like TruMatch. There's a couple ways to do some type of computer assisted. You can actually plan surgery ahead of time, or you can plan surgery intraoperatively. Traditional navigation, we used to make the plan intraoperatively, which takes somewhere between 10 and 15 minutes and actually takes a fair amount of intellectual energy, if you will, because you're adjusting, modifying, and interacting with the computer while you normally would be operating. The advantage of the patient-specific instrumentation, something like the TruMatch, is that we actually do that preoperative planning ahead of time in the outpatient setting before we get to the OR. So when we get to the OR, all we really have to do is enact the plan, and then maybe if we're making these minor tweaks for patient-specific alignment, we do that. The nice thing about a system like TruMatch is actually there's a plan that's generated, and then the surgeon signs off on that plan, and also the surgeon makes the preferences for the plan. So you have the opportunity, if you wish, to actually make specific plans for the soft tissue. One of the advantages of the TruMatch is the opportunity to really work with an engineer who's made the plan, and if you want to make modifications, you just engage with the engineer on how you like the surgery planned, what works well for you on an individual level. In some ways, 2 sets of eyes looking at the plan. The idea is to come to the OR, everything is already planned. There's no concern about how I'm going to get through this case, what resections I'm going to do, because we've made all those decisions ahead of time. Yeah, one of the things I particularly like about the TruMatch system is that you can use the custom cutting guides to cut through the guides, or you can use them as pin guides, or you can do some form of hybrid. The flexibility of using any combination of those approaches really makes the system, I think, user-friendly for the surgeon. Mechanical instruments, in my opinion, are like eyeballing the adjustment, but using custom cutting guides and CT scans ahead of time, what we're doing is we're actually really tailoring it to the patient's bone. And the concept is if you tailor it to the patient's bone, it's going to feel better. And the concept of restoring the anatomy as opposed to, if you will, destroying the anatomy and then rebuilding it. With that, as we know, if people have significant soft tissue deformity, sometimes that mechanical access plan would require soft tissue releases like medial collateral ligament releases, posterior lateral corner releases. And so with a personalized, what they call patient-specific alignment, but then in surgery we don't do any soft tissue releases. And so the idea is to actually make small cuts in the bones without the need for soft tissue release. But more importantly, my patient outcomes actually demonstrate that this really works. The patients immediately notice a difference when they're walking. The knees feel more normal, they don't feel clunky to them, they don't feel like they're not theirs, which are some of the common complaints we see with knees where soft tissues are released. The Attune implant has some design features that were well studied and well researched that actually are really focused on reproducing a normal anatomy of a patient, rather than taking the patient's normal anatomy and making it meet the implant. When you couple that with patient-specific information, CT scan, like we do ahead of time with the TruMatch. Now we have an opportunity to put the implant back to where the bone was without actually damaging ligaments and cutting ligaments. To say that all the things together have radically improved patient outcome, better implants, better implantation technique, better pain control, better blood management, better physical therapy in terms of less frequently because it's not necessary. What we've found is that not only do we have a much lower patient dissatisfaction rate than is traditionally reported in the literature, but we also have far fewer manipulations. We have people coming in at 6 weeks on average 125 to 140 degrees of flexion, almost matching the other side, which 10 years ago was essentially unheard of. It's been multifactorial and we've changed a lot of things at the same time. One thing that I've actually personally been doing for over 20 years has been part of what's called an outcome tracking system. Specifically, this one is DePuy's outcome tracking system. So we've been keeping patient-reported outcomes really for over 20 years. And one thing that we've clearly been able to demonstrate is a radical improvement in patient outcomes over that period of time. And we have the opportunity to constantly review our own data and compare it to national benchmarks. And last year I did just about 600 total knees, and we didn't have a single patient get admitted to the hospital from the ASC. And that's because they can walk out of here in 3 or 4 hours, not traumatizing the muscle, not violating the intramedullary canal, getting an implant that feels normal because we're not cutting ligaments that someone has to heal from. All these things together really have improved dramatically patient outcome.